Good morning to each and everyone here. Dr. G.S. Rao, Managing Director, Yashoda Group of Hospitals. Such an enthusiastic person. When they came inside, he wanted me to take a tour, hospital tour. And the way he was explaining, really patients are very fortunate to get admitted in this hospital. And I told, entering the rooms itself, half of the illness will vanish because the ambience and the pattern of rooms, the gardens, and really as a doctor, when we went to Canada 30 years back, I used to dream that we should have such hospitals. But within my time, I am visualizing it. I am really very happy to visit because I have visited the other branches. But this branch is something which gives very extraordinary service to the patients. Dr. Pavan is almost one among our family, and when he called me for this program, usually my engagements are fixed almost 1 month before itself. And today morning I have to be in Madurai for a traders conference. And when Pavan came and told that this is the conference and we want you to come and inaugurate it, so I totally reorganized my whole program, because yesterday I am very proud that I unfurled the flag in 2 states, one in Telangana and the other in Puducherry. So first I unfurled the flag here, went to Puducherry, unfurled the flag there, and conducted at home there. Then again I flew to Hyderabad, conducted at home in the evening and morning for this, exclusively for this program. I am here and I have to fly to Madurai by taking my 1 o'clock flight. And when Pavan told, this is the conference of nephrologists, particularly dealing with the acute kidney injury, when I was introduced, they introduced me as wife of nephrologist. I am not only better half of nephrologist, I am half nephrologist. Why I am telling you? Because when I got married, I was studying my first year and my husband was second year nephrology student. But don't think it's a love marriage, it's a purely arranged marriage. Because immediately you will think, no, you see first year student, husband second year nephrology student, same Madras Medical College. So it's purely arranged marriage. And then we went to after his completing DM, he was posted in a peripheral medical college, Tanjavur Medical College, to organize the department. So when we went, no dialysis machine, no catheters, no department, no beds, no dialysis machine also. So but incidence of nephrology diseases were more in that area, because snake bite, diarrhea, dehydration, and farmers with mostly they come with snake bite, poisonous snake bite, and acute kidney injury due to snake bite. So we used to come to Chennai and collect the peritoneal dialysis catheters, and he used to use the side teaching room as the nephrology bed, and he used to introduce the catheter and I used to monitor. So as I said, I am the half nephrologist because no trained nephrology person was there at that time. And when he introduces the catheter or every shunt, everything, I only used to assist him. And if you ask me to monitor a dialysis patient, I will monitor better than a technician because I have done it. So when I get not near word, I really am not nephrologist. And really I am very happy that our friend Chakravarti, because in Tamil Chakravarti means ultimate, it's not king, more than a king. And he is heading the nephrology department, and he is one of the students of a very renowned nephrologist, and I really, my husband used to tell, you have to admire him, and he is very competent as a nephrologist. And my respects to Dr. Ravi Kiran, and my respects to Dr. Lingaya, Director of Medical Services, and already I told Rajashekar Chakravarti, because only half name I told is Rajashekar Chakravarti. and all the dignitaries who have come from abroad. And I want both of their names. And I say really I am very happy because it is AKI. When we were students it is ARF. And now it is acute kidney injury and continuous renal replacement therapy. And as I said, when we were practicing in the peripheral medical college, the awareness about the kidney disease almost nil. So one patient came and told, my kidneys are swollen. Then as a third year medical student, I was saying, how you could see the kidney? No, I could see the kidney. He was mentioning scrotum as the kidney. So usually the village people think that is the kidney. And because making them aware of the kidney disease, when they don't know where is the kidney and what is the problem we face. And another thing my husband always say, the patient doesn't arrive to the clinic of the nephrologist in the first step, because there is no any defined symptom. So they will go to cardiologist, neurologist and nutritionist, and finally they will land. And even if the nephrologist say, my husband always used to say, it is very difficult to make the patient understand that he is having kidney injury, chronic renal disease. When we say your kidneys are affected, then he will tell, no, I am passing more urine than my son. Because we know it will polyuria will be there. So he used to say, no, you are telling my kidneys are more younger than my son. Because my son goes to the toilet only 3 times, but I go to the toilet 5 to 6 times. So my kidneys are better. So it is very difficult. Then he will tell, no, you have chronic renal disease. Then he will tell, no doctor, you are telling, Google is not telling like that. So my husband always used to tell. Nowadays, before we used to compete with the consultants. Now we have to compete with Google. So the patients Google everything and do know everything, and even if we tell, before a patient used to accept, okay, nephrologist is telling, okay, we have to accept. But now they argue, no, Google is telling like that, you are telling, so 1 kidney is gone or 2 kidneys are gone, then what is the shape and everything. And when we order for investigation also, I have to, in a lighter sense I have to say, when I was as a sonologist, young sonologist, one of the pioneers in sonology, and one patient came for prostatic study. Then I told, tomorrow you should come with full urine. Then he came in the morning and he opened a yellow bag, put 1 Horlicks bottle full of urine on my table, second Horlicks bottle full of urine, and he told, what is this, I asked. No, you only told me to come with full urine. So, making them to understand, particularly kidney, because it's a practical experience for me. If we say it is heart, they understand. If we say it is brain, they understand. But if we say it is kidneys, it is very difficult to explain to the patient, even to common practitioners. In the initial days, I am not telling the recent days. And when we say acute renal failure, when I was teaching in the hospital, patient asked, no, renal failure is, what is the difference between acute renal failure and chronic renal failure? You are telling renal failure, but my son had renal injury and it will be revived, they are telling. And when I went to your doctor, they are telling, no, your kidneys cannot be revived. Then I told, you take a car. Car may stop without fuel. So that is acute renal failure. The engine is corrupt, and if it is to replace the engine, that is chronic renal failure. So you can put some petrol, so it can be moved. But if the engine is totally out of order, we have to remove the engine and put it, that is chronic renal failure. So it is to make the patient understand, and patients, the nephrologists know really. I always say my husband, you will be very happy not during our anniversary days or during the birthday of my children or even wedding day. He will be the happiest person when he see the first drop of urine from the transplanted kidney. That is the happiest moment. Most happiest moment is, he will call, oh I saw the first drop of urine. Then I used to, do you know that today is our wedding day? Oh, I forgot. But the most happiest moment for a nephrologist is the urine, see, from the transplanted kidney. So they are very dedicated, they should be very dedicated, but the pain will be experienced only the better half of the nephrologist. I should laud each and everyone, congratulate each and everyone for being a nephrologist, a lifesaver, because the patients are chronic patients. My husband used to tell, I have seen this as a nephrotic syndrome patient, and now she has grown and now she is under family way, and I have to take care until transplants, some 30-40 years they may be the patients. So I told nephrologists not only have patients, they also should be patient. Otherwise it is very difficult to explain about the transplants and the injury and the pattern, and now it's branched out. Actually my husband is the third nephrologist who got qualified from Madras Medical from Tamil Nadu. Because the rare specialty, used to say the nephrologists are rarest species. But now almost I am very happy it has been branched out into stone calculus nephrology and renal failure nephrology, transplant nephrologist and syndrome nephrologist. So nephrology has been branched out and really very happy. But at the same time, my appeal is the awareness about, particularly when you say acute kidney injury, and as a gynecologist we have seen so many cases due to acute bleeding and due to abruptio placentae and due to toxicity during the pregnancy and so many things. But at the same time the focus will be on the gynecological procedures. So to make them understand, and particularly when we want to take them for dialysis, and I really happy that procedures like CRRT is now this advancement, because when the patients cannot be dialyzed for 4 to 5 hours, this slow dialysis for 24 hours, removing the poisonous material, that is creatinine and everything, it's really a good advancement, and this will help the renal patients in the intensive care unit. And apart from that, I have to say, hypertension. Patients should be aware why we get kidney diseases. They don't think hypertension, diabetes or syndromes like nephrotic proteinuria will lead to renal disease. So this awareness, whenever it is diagnosed, this awareness should be there. So creating awareness among the public is a great effort. That should be the effort, and not only creating awareness among the public, awareness among the practitioners. It is very important, because they have to refer the cases to the nephrologist. So they have to identify it. It should not be, as we know, it should be the earlier diagnosis helps us a lot. And always when it is diagnosed, when I was introduced here, Pawan told it is very rare to see doctors into the politics. So in a lighter sense, I used to say, when I was posted as Governor of Telangana, I am the youngest person, youngest among governors, and I don't have experience as a minister or chief minister. So some of the critics came forward and criticized. So she is the youngest person, this is a newborn state, Telangana is a newborn state, and how she is going to manage. So I told, it's a newborn baby. Telangana is a newborn baby. I am a gynecologist. So I will manage. So a newborn baby I will manage. So immediately, when after 8-9 months, I was given an additional charge as Lieutenant Governor of Puducherry. The same critics came forward and told, oh, she managed Telangana and how she is going to manage another state. I told, I am a gynecologist. If singleton is born, I will manage. If twin baby is born also, I will manage. So the confidence, I can say, the medical profession gives us confidence to administer, and my male brothers should not get angry. Females are better administrators. Because you can manage 2 kidneys, okay? But a male cannot manage all females. A female can manage all males. But I have experience because my husband manages 2 kidneys. So because he says about midnight, then when we hear from the patients the fruitfulness of our treatment. My husband went with the actor Rajinikanth when he had some problem to Singapore, accompanied him as nephrologist. When they landed, one person came and told my husband, I am the person who you saved with the peritoneal catheter. I was a bus conductor, and now I am an employee in the airlines, Singapore Airlines. He was very much surprised. Then he told, without that procedure, I wouldn't have been alive. I all left hope. And because you came as a young doctor, you had some catheters and you put some fluid, and now I am alive. So even now, in spite of so much of advancement, so much of the peripheral areas, large number of villages, even the importance of peritoneal dialysis cannot be excluded. It is my personal experience. And when fluid was, they told about our contribution in getting the endorsement for nephrology transplants. Another thing I have to say, the peritoneal dialysis fluid was very costly and it was not produced in our country. So we have to import it. So when I had a discussion with Madam Sushma Sivaraj, she was the health minister, and I told this poor patients also suffer from kidney injury, but it is very difficult to treat them. And she exempted the tax and she motivated the production in the our country. So a doctor be an administrator, definitely we can manage the health of the patient as well as the health of the society. That is very important. And dedicated these research activities, particularly these acute kidney injury and in the dialysis and in the transplants, and it is very important that each and every day we have to move into service research activities. And as I said, the awareness about the kidney disease should be highlighted to the ordinary people. There should be more movies, there should be more pamphlets, there should be highlighted to even the practitioners, so that they are well aware they are dealing with the renal patient. So it is very difficult to convince them. It is just my own experience. So I am really very happy to address you all, and as I said, you are lifesavers, and the only person unhappy is your family members, not your patients. Patients are very happy, but at the same time nephrologists used to spend more time, explain more. I had an experience. Patients, when I was working in the ICU in the Tanjavur Medical College, my sir used to tell, patients are not unaware of our toiling, our difficulty in managing. Once one patient with cardiac arrest came. So we were about to leave the hospital because we completed our duty. Everyone got into that, revived the patient and underwent he underwent emergency bypass. Next day he was in ICU. Then our sir, we were all going for rounds. Sir was very proud that we have saved a patient. Then he asked, how are you? What, sir? Morning I didn't pass motion at all, sir. What is this, sir? So he is not aware that we saved the patient. Emergency bypass was done, but he was worried about only the motion. So these are that we should not get angry. We should laugh at them. We should be happy, at least we are able to talk to you, because the condition we can imagine the previous day. So it should be very patiently deal the patients. At the same time, we must be aware of development. Each and every day medical science is moving. And I used to, because even though I am not practicing, I used to read each and every day this medical advancements. Otherwise, I should come and talk to you, no? So I should not tell that it is ARF, because now it is named. Then I should tell cadaver. It should be deceased transplant. So every day the name is also changed. And if I am telling the old name, then you may think I am a old-fashioned doctor. I am a new-fashioned person. So with all these things, I am really with the efforts of Pavan and Dr. Rao. I was very much surprised about this hospital, and it doesn't look like a hospital, it looks like a recreation center. So let the patient be happy, no? Why they have to have closed walls and and seeing the doctors in that way and all. So I'm very, very happy, and I wish you all the best. And everywhere, wherever I address doctors, one appeal I used to make. We doctors, we say, okay, you look after your sugar to the patient, but you won't look after, I don't know how many of you tested your sugar recently. Check your BP. We won't check our BP. Don't get tensed. We will let the patient, but we will be the patient. So look after your health. It is very, very, very important. And another thing, I always laud our Honorable Prime Minister, because this AKI, CRRI, all treatment is under Ayushman Bharat. Because as a medical student, I have seen patients dying for want of 100 rupees, 1000 rupees for want of some medicines. But now 5 lakh insurance is there, and a village person can get the treatment from a tertiary center, particularly renal diseases. So these type of insurances. So we have to motivate the patients to get medical insurance also. Because sometimes we may say the amount, the patient may not be able to spend also. So indirectly we have to motivate the patient, not only for awareness, for medical insurance, they have to make them register, and apart from everything, we also should be happy. We also should be healthy. So we should be smiling before seeing the smile from the patient. Thank you so much.